Hi students, now we are going to learn about the glossopharyngeal nerve. It's a ninth cranial nerve. So usually the cranial nerves are learned in the following titles: the functional components and its nuclear origin, cause and relations, branches and distribution, and its clinical correlation. So first we'll see about the general introduction part of the glossopharyngeal nerve. So it is a mixed combination of both motor and sensory nerve, and it is also the nerve of third pharyngeal arch. Why it is called glossopharyngeal? Because it supplies both tongue and the pharynx. It gives sensory supply to the tongue and the pharynx. Now we'll see about the functional components of the glossopharyngeal. The glossopharyngeal nerve has a 5 function components. The first one is a special visceral efferent. So the nuclear of origin is from nucleus ambiguous. The next one will be the special general visceral efferent. So the nucleus of origin is here, inferior salivated nucleus. And the next one will be the general visceral afferent. So here the nucleus of origin is nucleus tractus altarius. The special visceral efferent also the nuclear origin is nucleus tractus altarius. And the last one will be the general somatic afferent. Here the nuclear origin is spinal nucleus of the trigeminal nerve. So there are totally 5 functional components. You can easily remember. First one will be special visceral efferent. So visceral efferent is general and special, but the nucleus is different. Special visceral efferent nucleus ambiguous, general visceral efferent inferior nucleus. And if you see in the visceral afferent, so that is sensory, you have both general and special components. So both the nuclear origin will be nucleus tractus altarius, and the general somatic afferent is commonly the nuclear origin will be nucleus of spinal tract of trigeminal nerve. And you can see this all this nucleus are arising from the medulla oblongata. Okay. Now we'll go on to the next slide. So next slide about the cores and relations of the glossopharyngeal nerve. Before going in, this is the section of the medulla at the level of inferior olivary nucleus. So you can see the nucleus ambiguous, inferior salivary nucleus, dorsal nucleus of vagus, and nucleus of tractus altarius. And this elevation is the pyramid, olive, and inferior cerebellum. Now, so this nerve rootlets, rootlets of the glossopharyngeal nerve arising from this nucleus, they all pass through the posterolateral sulcus between the inferior olivary nucleus and the inferior cerebellar peduncle. So after emerging out of this, so this will join to form a single trunk, and it will enter the jugular foramen. So here it has 2 ganglia, superior ganglion and the inferior ganglion. Usually the superior ganglion is a detached part of inferior ganglion, does not give any branches. But if you see the inferior ganglion, it lies in the inferior surface of fetus part of the temporal lobe, and this forms the important main trunk of the glossopharyngeal nerve, so which leaves the foramen and it enters the neck. Okay, so after entering the neck, it gives immediately a tympanic branch. Then this main trunk will passes between the, see here, this is the jugular foramen. So this is internal carotid artery, internal jugular vein. So this is the glossopharyngeal nerve. So now the glossopharyngeal nerve enters between internal carotid artery and internal jugular vein after emerging from the base of the skull. So here it crosses the stylar process and stylar group of muscles also. Then, so if you see the previous picture, it winds from the lateral border of the stylopharyngeus muscle here. Then it enters here, it gives a pharyngeal branch which passes between the middle constrictor and the superior constrictor muscle. Then this main trunk again goes and terminates by dividing into tonsillar branch and lingual branch. So this is the code and the relations of the glossopharyngeal nerve. So in a flow chart, Okay, so just I have represented all this thing in a flow chart. So first we will see about the intraneural course. So this glossopharyngeal emerges from the nucleus ambiguous, then nucleus tractus saltates inferior salivary nucleus from spinal nucleus of trigeminal. 3 or 4 nerve rootlets passes through the postulator sulcus of upper part of medulla oblongata above vagus nerve rootlets. Then this pass forward and it enters the jugular foramen. So after entering the jugular foramen, it forms the nerve. So here it has two ganglia, superior ganglia and inferior ganglia. As I said previously, superior ganglia has no branches. It is a detached part of inferior ganglia. Inferior ganglia lies in the depression in the inferior surface of deepest part of temporal bone. Then this emerges as trunk of nitrum, leaves skull through jugular foramen. Here it is accompanied by vagus and axilla. Then it exits out of the skull. It passes forward between the internal jugular and internal carotid artery deep to stylofosso-styloid group of muscles. Then it winds from the lateral part of the stylopharyngeus, then reaches pharynx between superior and middle constrictor and gives pharyngeal branch here. Then it enters submandibular region, passing deep to higher classes. Then it breaks into tonsillar and lingual branch. So this is about the extracranial course. Then if you see the branches and distribution, as I already said, superior ganglion does not give any branch. The inferior ganglion gives tympanic branch, first branch, so which enters the tympanic canalicus and it enters the medulla. So here this tympanic branch joins with the carotidotympanic nerve from sympathetic plexus around internal carotid artery. So this forms tympanic plexus. From the tympanic plexus, the sensory fibers arise and it supplies the medulla. So which part of medulla? Mucous membrane of tympanic cavity, tympanic membrane, mastoid angle and mastoid axon. Now, one more important branch will arise from tympanic plexus, that is the lesser petrosal nerve. So, which relay in the aortic ganglia. From this postganglionic parasympathetic fibers arises, so which passes through auriculotemporal nerve and gives secretomotor fibers to the parotid gland. So that's all about the tympanic. What are the other branches given by the glossopharynx? So the next branch given by is the carotid branch. So this carotid branch given in the carotid triangle joins with branch of vagus and sympathetic nerve. They form the carotid nerves. Okay, so they go and supply the carotid sinus and carotid body. So that's how it regulates. It acts as baroreceptor and chemoreceptor to regulate the pressure and heart rate. So now you have seen about the carotid branch. So the next one will be your pharyngeal branch. So the pharyngeal branch joined with the pharyngeal branch of vagus and superior cervical sympathetic ganglia form plexus and gives sensory supply to the mucous membrane of the pharynx. So in this you have to remember the pharyngeal plexus formed by the pharyngeal branch of vagus and superior cervical sympathetic ganglia and the spinal root of axillary nerve supplies the muscles of the soft palate and the pharynx. Okay, here the pharyngeal plexus formed by the pharyngeal branch of glossopharyngeal, vagus and superior cervical sympathetic ganglia use sensory supply to the mucous membrane of pharynx. Then next we will see about the next branch. Next branch is the muscular branch. Since it is a nerve of third pharyngeal arch, the only muscles derived from the third pharyngeal arch is the stylopharyngeal that is supplied by the glossopharyngeal nerve. The next branch will be your tonsillar branch, which supplies us the palatine tonsil. Then this tonsillar branch joins with the middle and posterior palatine nerves to form a plexus, which supply the soft palate and passes. Okay. Then we'll see about the last branch, that is the lingual branch. The lingual branch to the tongue. So divides into two, anterior and posterior. Anterior supplies the valid papillae and area in front of sulcus terminalis, and the posterior branch supplies the posterior 1/3 of the tongue. So both these branches, that is lingual branch, convey taste sensation and general sensation from the posterior 1/3 of the tongue. So with this branches are over. If you see the clinical correlation of glossopharyngeal nerve, so the lesion of a glossopharyngeal nerve is always not isolated. It is always with vagus nerve. If it happens, there will be loss of taste and general sensation over posterior 1/3 of tongue, difficulty in swallowing, loss of salivation from the parotid gland, and unilateral loss of gag reflex. So what is glossopharyngeal neuralgia? In case of glossopharyngeal neuralgia, the patient will get a sharp pain over the distribution of the glossopharyngeal nerve branches, that is the pharynx, soft palate, and the posterior frontal of the tongue. So how will you test the glossopharyngeal? By one mode is gag reflex. The next one will be the testing the taste sensation in the posterior one-third of the tongue. So with this, I'll finish the glossopharyngeal nerve. So if you breathe the glossopharyngeal nerve, so it arises from the core nucleus ambiguous, inferior salivary nucleus, nucleus tractus saltaris, and spinal nucleus of the trigeminal nerve, emerges between olive and inferior cerebellar peduncle. Then it enters the jugular foramen. Here it has two ganglion, superior, inferior ganglia. Superior ganglion doesn't have any branch. Inferior ganglion gives tympanic branch, so which enters the tympanic calculus, form tympanic plexus. Through this, it gives secretomotor supply to the parotid gland. Then other branches are muscular branches to stylopharyngeus, carotid branch for carotid sinus and carotid body. Then it passes between superior and middle constrictor. It gives pharyngeal branch. It supplies the mucous membrane of the pharynx and soft palate and flashes. And it gives a lingual branch to the tongue and circumvallate papillae, and tonsillar branch to the palatine tonsil. So with this, I'll finish this. Thank you.